coming. As Jim said, I'm Dr. Stephen Turkovich. I'm the president here at Oshai Children's Hospital. Thank you all to our partners at CWA, at SEIU, to our elected officials who I know who are here and also listening to us. This is such an important piece of information for the entire community. So, as a father, a pediatrician, and as the president here, it's a complete honor and privilege to serve the kids and the families of Western New York. They're the ones that need us the most. Unfortunately, the medical, social, mental health, and economic challenges facing the families of our community have never been greater, and they continue to grow each and every day. Some numbers to put things in perspective. In the 8 counties of Western New York, 1 in 5 children live in poverty. This represents over 61,000 children who are our neighbors, our friends, and family members. Their health and well-being is directly impacted by the effects of poverty. In Western New York, over 16,000 children have a disability, many of whom rely on the support and services funded by Medicaid. As the only children's safety net hospital in Western New York, our team of dedicated healthcare workers care for over 15,000 patients admitted to this building every single year. In addition, annually we provide care for over 47,000 visits to our emergency room, almost 100,000 visits to our primary care and specialty clinics, and almost 10,000 visits to our pediatric mental and behavioral health center. Unfortunately, the healthcare industry continues to face financial headwinds following the COVID-19 pandemic. Governor Hochul and the Western New York legislative delegation have recognized the financial hardships across the healthcare sector. They understand we need help. Last fall, Governor Hochul made a $25 million commitment to Oshai Children's Hospital, as well as a historic investment in the healthcare industry for fiscal year 2024. We applaud Governor Hochul for this and her commitment to mental health. We're appreciative of the state's support, but much more needs to be done to address the ever-changing healthcare needs of the kids and families in our community. At Oshai Children's Hospital, 60 to 70% of our patients receive health insurance through Medicaid. In our primary care centers, that number increases to over 90%. Although New York State has one of the lowest rates of uninsured children, Medicaid only funds 61 cents for every dollar spent to care for a patient who receives Medicaid. 61 cents for every dollar. This is simply not sustainable. We need a robust and sustained funding plan to ensure we can collectively and effectively address the social determinants of health for our community's kids and families. When only 61 cents of every dollar spent is reimbursed for over 70% of our patients, it's nearly impossible to invest in the resources needed to support our children and ultimately help them grow and thrive and reach their full potential. We need support to hire more social workers, therapists, mental health specialists, community health workers, and care coordinators to address and eliminate the socioeconomic disparities that were amplified during the pandemic. We need support to ensure we have enough nurses, enough MAs to care for the sickest and most vulnerable children who are admitted to the hospital and seek care in our ambulatory centers. The Western New York legislative delegation continues to advocate for additional funding for distressed hospitals, particularly those in our region, and we thank them for their support and their commitment. We know that investing in children's health and well-being builds a stronger community. These investments keep children in school, strengthen and grow our workforce, and ultimately grow our economy. It creates healthier adults. It provides a path out of poverty. And quite simply, investing in children's health and well-being is the right thing to do. In closing, thank you, and we stand ready to partner and protect investments in healthcare across this community for children and families. Thank you. And now it's my honor to introduce Debbie Hayes, who is the Director of Communications for CWA.
Okay, Debbie. So my name is Debbie Hayes, and I'm the Upstate New York Area Director for CWA District 1. CWA represents about 15,000 healthcare workers in New York State. And while that may be small in number, we take very seriously the advocacy work that we have to do on behalf of our members. And I think you may know or maybe can assume that healthcare is a very labor-intensive industry. It is our members that provide the bedside care, that run the labs, that take the pictures, that tend to the psychosocial needs of all of our patients. And when the hospital systems are in duress, when they are not funded adequately, it is our members who are affected on the job, and it is our patients that suffer every day. So I think it's important to say that hospital systems in New York State are in crisis. We're working very hard to fix the staffing problems in our facilities, but it's still tough, the word I'll use. Working conditions for some are untenable, and patient care is suffering. Recent studies have shown that the two biggest reasons healthcare workers leave the industry is number one, for better pay, but number two, to escape burnout. The conditions that folks work under when there aren't ample funds to provide staffing and equipment and supplies, the things people need to do their jobs, pushes our members out the door. So hospitals in Western New York are struggling probably more than hospitals in other areas of the state. 4 out of 5 hospitals in New York have negative operating margins, and I don't know if anybody in Western New York is operating in the black at this point. We're still suffering the effects of the pandemic. Major sources of revenue, operating revenue, have dried up, and we have, again, a number of facilities that are ending their fiscal years with significantly negative balances. So I am here speaking on behalf of all of our members in the labor movement and for all of those who provide patient care to say, we need the governor and we need the legislature to ensure that the $1.3 billion we are looking for is allocated to safety net and financially distressed hospitals. We will never get out of the spiral we're in if there isn't substantial investment in our hospitals. We are looking for a 10% across the board increase in the Medicaid rate to ensure more sustainable funding for our hospitals and our healthcare systems. And we're looking for 20% increase in Medicaid rates for our long-term care facilities that have just been overlooked for way too long. So we must act now to make sure that we can improve working conditions, protect our workforce, and ensure that the most vulnerable New Yorkers can get the care they need, and that hospitals are able to keep their facilities open, continue to serve the communities that they are in. Thank you very much. Oh, and I'd like to introduce to you Cheryl Marino, Administrative Organizer from SEIU 1199.
Thank you, Doug. So I'm here right now to just talk about a little bit about New York State. Obviously, currently is just coming out of a pandemic that we've been dealing with for over 3 years. We've had staffing shortages, and it's still ongoing and present, as Debbie had said. But we are also in this healthcare crisis where last year, Oshai Children's Hospital was deemed a safety net hospital. OSHI services some of the most vulnerable patients. As Dr. Turkovich said, 1 in 5 children live in poverty. That is unacceptable. We are the second leading city in nationwide that has the highest poverty level. I sometimes can't wrap my brain around that because it just is not okay, and we have to do everything we can to make sure that these patients are taken care of. Safety net facilities like OCH rely heavily on Medicaid funding as their source of revenue. Safety net hospitals provide to a large population, most of our community. Dr. Turkovich even said about how it devastates our schools, the amount of children we have in our communities, our neighbors, the people that we see every day. A majority of Medicaid patients come from these obvious low-income communities, and the cost of providing care is increasing, yet their reimbursement levels are not. Governor Hochul must support our safety net hospitals with at least, you said you were going to give me the numbers, but over $600 million in additional funding and no cuts. The Medicaid coverage gap must be closed by increasing reimbursement rates for up to 10%. As a former healthcare worker working here at OSHI Children's Hospital, I see the devastation of the socioeconomic, the mental health issues, the issues that deal with all of the women and children that we deal with here at Children's Hospital. And we must do better. And I think collectively as a community, we must let our voices heard, and we must continue to fight this fight because it is the utmost important for not only our future, but for the children and the women that we care for daily. So I'm going to pass it on to Janine Gonzalez, who is an RN in the NICU, and I will let her speak.
Hi, my name is Janine Gonzalez. I'm a registered nurse right here at OSHI Children's Hospital. I've been a registered nurse for the past 34 years. My colleagues and I worked through the pandemic providing care to the tiniest babies in our 64-bed neonatal intensive care unit. Our patients require around-the-clock critical care. We recently became a safety net hospital because we provide care to so many low-income residents in our community. But upstate Medicaid reimbursement rates lag behind the rest of the state, and the cost for providing care is increasing, leaving our hospitals to supplement that cost. We were called heroes, and we thank everybody for that designation and their support. But now we must call on Governor Kathy Hochul, a hometown native, to provide adequate funding for our safety net facilities like OCH, so that we can continue to save lives and provide the best care possible to our patients, our families, and the community. Thank you. And I'm going to announce Evelyn from Niagara Falls Memorial.
Good afternoon. My name is Evelyn Harris. I am from Niagara Falls Memorial Medical Center, and our hospital is a safety net hospital. Our hospital has been a safety net hospital for many, many years now. Fundings we have not received because of the fact that the reimbursement rate that comes into our hospital is, of course, if you got a $1,000 x-ray to be done, you know, we're lucky if we're gonna get half of that back. And a lot of people, including the public, do not understand that, okay? I am a 40-year person at the hospital, actually over 40 years. The people that work at the hospital, whether it be the housekeepers, dietary, nurses, we all came together during the pandemic. We did what we need to do at that time. We took care of people. We held people's hands when nobody was there to hold their hands. When they were dying, when no one was there, we were there, whether it was in the hospital, whether it was in the nursing home. It is time for us to be given more to work with. We cannot work with what we have right now. It is impossible. We have a lot of single families, single mothers that work at our hospital. They can't work for $14 and $15 an hour. How can they feed their kids? People talk about people being on welfare and all of these things. You will continue to have these people where they are if you don't do something about it, meaning pay them what is right. If I come to work every day and I do my job, then I expect to be paid. And we cannot get paid with the reimbursement now. I am asking our Governor Hochul, that you do the right thing now. You think about those times, because we are a minute away from another pandemic. We don't know when it's going to come. We don't know what's going to come. But I can guarantee you the people that are working at my hospitals, other hospitals in this area, the nursing homes in this area, those people would be there to take care of your loved ones. So you need to think about that, and you need to get on the phone, and you need to call your legislators, your senators, and call Governor Hochul and tell her it is time to do the right thing by these people. They did the right thing by us. That's right. Thank you.
I'm the Director of Corporate Communications for 18 skilled nursing and rehab facilities in New York State, namely the McGuire Group and Absolute Care here in the Buffalo region. And I just want to thank 1199 for giving us this platform today to share our opinions regarding the perilous situation facing New York State nursing homes. Simply put, the current system is unsustainable. The reality is 80% of all resident days are paid for by Medicaid, and 93% of nursing home providers indicate that Medicaid doesn't adequately cover the cost for care. These costs include salaries, benefits, building improvements, supplies, etc. The situation was obviously exacerbated during the COVID-19 pandemic and continues. Nursing home operating expenses have increased by 23% between 2017 and 2021, while reimbursement has only increased by 3.5%. In fact, New York State has the largest gap between cost of care and Medicaid reimbursement, one of the largest gaps. The challenge facing New York State nursing homes and their future is dire. By 2030, it's projected that there will be 5.3 million individuals aged 60 or over, with 1.2 million being aged 80 or over. Nursing homes are an important step in the continuum of care. We form strong relationships with local hospitals and community providers. 93% of our admissions come from the hospital. Inadequate reimbursement rates could mean fewer skilled nursing beds, and this results in problems along the continuum of care. This could mean that hospitals are bedlocked, meaning patients are in the hospital longer than expected and longer than they need to be. It also makes problems for other providers in the community who are forced to provide higher levels of care. Without meaningful reimbursement, the sustainability of our current system could fail, and we will not be able, and this will impact multiple providers in the community. We are doing our part for workforce development. We have recruiters at each of our facilities. We have aggressive digital advertising campaigns. We offer sign-on bonuses, referral bonuses. We've invested in retention. We form community partners for MASH camps to reach high school students, to let them know what opportunities are before they even realize that they'll need to know what these are. We've offer paid CNA training programs. We partner with 1199 for nurse apprenticeship programs. So Governor Hochul is suggesting a 5% increase to the reimbursement rate. We are asking for a 20% increase to allow nursing facilities to be competitive and sustainable, so that we can continue to be a valuable resource to those we serve and our partners in the community. Thank you.
Good afternoon, everybody. My name is Grace Bogdanov. I'm the Vice President of the Nursing Home Division for 1199 SEIU. We represent several thousand nursing home workers across Western New York who provide care for some of the most vulnerable members of our community, the elderly, particularly those who rely on Medicaid funding for the care that they receive. You see before you today a joint coalition of industry employers, labor unions, and our community as we speak with one voice, calling upon Governor Hochul to close the Medicaid gap in New York State. Our state has one of the largest Medicaid reimbursement gaps in the nation, covering only 76% of the cost of providing care. And Medicaid reimbursement rates are significantly lower in Western New York and upstate versus the rest of the state. In the upstate region, the average Medicaid reimbursement rate is only $214 per day, with 90% of our nursing homes falling below the statewide median. That means even fewer dollars are available for wages and benefits upstate as compared to the rest of the state. There's a clear link between quality of care and staff turnover, and it's no surprise to all of the folks in this room who live and work in this reality that our region has the highest turnover rates of healthcare workers at a whopping 55% turnover. We know that quality care depends on a stable workforce and that lower compensation in the nursing homes in our regions correlates with higher turnover rates. Ultimately, improving healthcare worker compensation in upstate New York will play a critical role in lowering turnover rates and improving quality care. But we can't begin to do any of this work without closing the Medicaid funding gap. So Governor Hochul, without proper funding, our nursing home facilities, particularly those in your own hometown, are on the brink of closure across our communities. Jobs are at risk, and quality care for the most vulnerable members of our communities is in real jeopardy. We're calling on you to do the right thing and to increase Medicaid funding for nursing homes by 20%. Lives depend on it.
Good afternoon, people. My name is James Funderburg. I'm a proud member of 1199, and I work out of a facility in Elderwood at Williamsville in Amherst. 20%, people. 20%. That's what we need. It's not what we want. It's what we need. And it's extremely doable, especially if you guys are asking for 100% of our effort. Even a little bit more with our short staff. As one of the many people that works in the trenches, I just have one story for you guys. We in Buffalo, so every single person in here should be a Bills fan. It was this one patient, he took pride in watching the Bills. In our last game, it's not too much to talk about, we're not gonna get on that, but we lost the playoff game pretty bad. So when I went to work the next morning, I was expected to get a pretty mad crowd. It was one resident in particular. We talked to Bills all the time, so I seen he had an attitude. So I kind of figured he watched the game. So I tried to beat him to the punch, break the ice, and hey man, did you see the game? I know they ain't give us much to watch. He told me he wouldn't know because he didn't get a chance to see the game. I asked him why. He said he was in the bed and he dropped his remote and it fell underneath his bed. He rung his call light. He had to wait for 5 hours before somebody answered. It was 1 aide to 40 patients that particular day. So they didn't even see his call light until the game went off. So again, 20%, because what that 20% will do, it will make sure that your mother, your grandmother, your father, your grandfather don't have to wait 5 hours to watch his or her favorite team play football. It's doable, especially if you're asking for 100% effort. Thank you.
I got the look, so I guess that means I'm up next. All right, folks. Good afternoon. My name is Peter DeJesus Jr. I'm the president of the Western New York Area Labor Federation. I've been asked to close things out, so I'm going to be brief and as blunt as possible. But before I do that, I do want to recognize folks standing in solidarity with us, especially our union siblings, representing healthcare facilities across Western New York. I want to recognize CWA for standing with us, CSEA, who is standing with us. We have PEF, who is standing with us, and NYSNA, the New York State Nurses Association, is also standing with us on this issue. Things like the budget don't get done in a vacuum. We have partners in the political realm as well who are standing with us. We have a representative here from Senator Tim Kennedy's office. Applause. We have representatives from the Assembly as well. Assemblyman Bill Conrad is here. We have a representative from Assemblywoman Karen McMahon's office, as well as Monica Wallace's office. We thank them for being here. We also have our county-wide legislator, Howard Johnson, here as well, supporting us. So you've heard it all today. For over 3 years until this day, healthcare heroes continue to put this great state on their collective backs. They are forever answering the call to service in our darkest moments. They've continued to show up and to serve even when overworked, underappreciated, and given the governor's budget proposals, forgotten. The viability of our healthcare system in New York State is at risk should we choose not to close the Medicaid coverage gap and fully fund our healthcare institutions. What is being proposed in the state budget is a travesty to healthcare workers and institutions alike. We have to do better, and let's be clear, our governor has to do better. If we are to address the healthcare needs of New York State, we must, number one, increase Medicaid reimbursements 10% for hospitals and 20% for all nursing homes. We have to restore the $700 million in safety net funding and increase it by an additional $600 million. The governor has to adopt the Senate or Assembly's proposal on 340B, funding for safety net providers, including the federally qualified healthcare providers. Yep. She must address the disparities in the reimbursement rates, as you heard, in upstate, which average are about 20% below our downstate counterparts. And lastly, they must preserve the investment made last year in the fair payer for home care to stabilize home care workforce. So in closing, I say this. Governor Hochul, it is never too late to do what's right. That time for the hundreds of thousands of healthcare heroes and the millions of New Yorkers that depend on our healthcare institution is now. Thank you.